Hi, everybody. Welcome to our last class in this series of group theory and practice. Today, I'm going to talk about group leadership qualities and skills. So, these are the various skills and personal qualities and therapeutic capacity that you might want to use in order to be a successful group therapist. So, let's see. You, as the leader, I think it's quite broadly accepted that one of the major capacities that you need as a group leader, as a group therapist, you need to have courage. You need to be able to step there in front of your whole group and be the leader for them, and without really leading them into a direction, but mostly following them where they are going. That takes a lot of courage. And it also takes a lot of presence, your ability to stay present with them. And I think you cannot do any of this work without caring about your group members, about your clients. And not only paying attention to the individual members, but you also need to have that faith in the group process. You need to believe in that this group therapy is going somewhere, that it's going to be beneficial. And even though the ride might be bumpy sometimes, and it might be difficult for the individual members, or it might be difficult for the whole group, but if you have that belief in the group process, if you understand that even though there are different ways to get to the goal, which is the therapeutic outcome for all the members, you will get there and the group will get there. And you just need to stay for the ride. You need to be open, and it's part of being open is your spontaneity, which is the last point on this slide. But also you want to be honest and open about your own process that's happening in the room. And that usually takes some practice. You need to practice that, how to be so open and honest and genuine and authentic in the room. But once you get a hang of it, hopefully it really comes naturally. These are some of these qualities on this slide really need to be there in you in order to then pick up on these qualities and nurturing them and maybe strengthening them, and then you will become a really successful and effective group therapist. It's very important that you would be a non-defensive therapist, because part of the deal in group therapy is that you have to be able to pull the anger and the negative feelings from the group towards yourself. This is one of the skills that I think is very important as a group therapist. You have to understand that in a regressed group, or if you are paying attention to all the unconscious, the group unconscious, there are many affects that are expressed among group members towards each other, but really the most helpful way for them is when they can feel it towards you. And anger is really one of those feelings that uh, that often people feel towards the authority figures, towards the parents, toward the therapist. And it is very difficult to face the therapist and be very clear about that. And even not because they are aware of it and it's easier to find another target, but very often it is an unconscious uh, experience, and you have to draw on it. And so part of that is that you have to be really non-defensive and really be interested, again coming back to the caring about your group members, being interested in them to the degree that you want to really look at what is at the root of their anger or negative feelings towards you. Having stamina is very important, because a group, just a regular group, lasts 90 minutes, and you have many people you want to pay attention to. And then, of course, there are many other ways that groups are set up. Often you will be leading all-day intensives, and you really need to pace yourself to stay tuned to the group as a whole and also to each individual member. And then sense of humor is really, I think, part of the repertoire of a genuine, authentic therapist. But in group, it's really inevitable that you would have a sense of humor and you would be able to engage on that level with your group members. And then spontaneity and inventiveness. You want to be able to respond to whatever is arising in the room, and for that you need to be spontaneous. You want to be able to go with the flow, and then you also very often have to invent your own therapeutic interventions. So in order to achieve your goals and in order to practice all those skills on the previous slide, you need to have a certain amount of self-awareness. And really that is something that we are also trying to bring out in our group members, an increased self-awareness. And if all these skills and qualities are in place, eventually self-growth will follow. The certain skill set, the certain skills that you want to use as a group therapist. First of all, you want to practice your active listening skills, which you also do as an individual therapist or couple therapist. And reflecting on of what you are hearing from your group members, the ability to clarify those. I think the active listening and reflection is equally important in individual therapy, but the clarifying might be already a step ahead in group therapy, because it's very important. In a way, you are modeling to other group members that it's really important for you to understand what each member really means. So it is okay or even desired to come back to parts of group members' content that you want to clarify. You really want to understand what they mean. And it's not always understanding what they actually said, but more what is it that they actually mean by that. So it's not always just the words themselves, but you want to clarify maybe the motivation, the intent, if they are telling a story about different people in their life. You don't want to clarify who said what exactly, but you want to clarify maybe their role in that conversation or in that exchange, what they are talking about. Because sometimes people, when they tell stories in group, they would focus on the he said, she said, what happened. And then even though they started from that feeling that the reason they brought this story up is because they had a certain feeling or they had a certain experience in that situation and they wanted to bring that into group. But by the time they tell the whole story, maybe they already forgot their role in it. And they really want to convey what happened there. So they will be focusing on other people. So the clarifying part of that is that you clarify their role and what is it that really they mean by the what's the link that brings this story into the room. And then bridging or linking, as some other authors call it, or Lou Ormond started calling it bridging, and it's his technique. And since then, many group therapists use bridging when, and that's definitely something that you do not use in individual or even couples or family therapy, because bridging is something where you create a new bridge that didn't exist before between group members. So you are bringing group members' attention to the fact that they can relate to each other's experience and they can even clarify or even kind of guess what the other group member means or feels or experiences. And you want to build those bridges and strengthen the group cohesion by that. the relationships or relating to each other in the group. Confronting is a very important skill in group therapy. You might do it also in other types of therapy, but in group therapy, you really want to be able to call people out on things that they are doing habitually, and especially those things that then evoke um, reactions from other group members. And when you confront the person, of course, you are doing it in a nurturing and caring way, and with their best interest in your mind. But confrontation is something that you want to model also for your group members. And for many therapists, it's not an easy task to master, not an easy skill. You want to be very supportive of all your group members, and that can be actually a difficult task. While in individual therapy, we are used to it. We know that we are there to support this person in their journey. But when you have a whole group of people, especially if they have conflicting needs and conflicting desires or ways of expressing themselves, supporting each member can be a tricky business, because you want to be supporting each and everyone at the same time. And that really requires a good understanding of group dynamics. Also, the roles that, as we talked about, the emotional leader, the scapegoat leader, the defiant leader, and the task leader. So if you identify those roles, that might help you in your task of supporting all the people, understanding at what stage of group development the group is currently in. That can also help you to find ways how to support people who are in an acute conflict situation in the room, in the here and now. Um, and I think that's all I want to say about that now. You want to be able to assess your group members. And again, it can be more difficult than in individual therapy. Assessment like diagnosing people or having an understanding of the underlying pathology, if you want to call it or the level of mental health in the group, in of the certain clients. So you want to have a good working understanding of assessment and evaluation. Um, and then a very important skill for a group therapist is modeling by your own example, which again, it can be used in individual work and in couples work. Um, but in group therapy, your members will be looking to you much more for modeling their behaviors and their experience after you, much more so than in individual therapy. And in a group, you will be also modeling interactions. How you talk to certain group members will be a modeling action for other group members, how they would talk to each other. So, some further skills for you as a group therapist. You want to be really nurturing and holding and containing while you are testing and while you are maybe taking some risks, how you push certain group members. When you feel that testing, that pushing is, or that confronting is what's needed, but you always want to make sure that they sense your nurturing, and that's the place where it comes from. So you want to maintain the safety of the group setting. Limit setting is maybe similar to confronting. You want to make sure that all the group members are in line with the therapeutic goals of all the group members, meaning that while confrontation or naming difficult emotions, or naming difficult interactions among group members is very important, but you want to remain again in the safety of the group setting. There is no acting out, there is no name calling, and there are certain members who get triggered, and uh, when they get triggered, they might even just momentarily lose the ability of maintaining the group norms and the group rules that they agree to. But very often, when they are in this regressed space, they are not able to maintain those. And this is, of course, very normal and natural. You can normalize it at certain times, but it's also very important to remind them that there is no getting out of your chair, or there is no raising your voice, because that will feel unsafe for both you and other group members. So then you have to be very firm and set limits that way. And again, I keep coming back to being able to containing and holding the whole group. And that is quite a task to be able to do that. And you can use many different nuanced skills uh, in order to achieve this containing and holding environment. You can use your timing, when and how you talk to different group members. You can use your gaze. Very often, group therapists will use their gaze looking at other people, rather than not only at the person who is talking, but really gauging what's happening in the room. And very often that gaze can be very containing for group members who are listening to the person or the persons who are talking. I put here on this slide riding the wave, which is coming more from the mindfulness perspective, really going into your uncomfortable feelings, and not stopping when you start sensing that there is discomfort. Of course, you want to be mindful, and if it's really a danger sign, then you want to set the limit. But if there are just uncomfortable feelings, either for you or for other group members, actually in this one it's more for you. If you are going towards your own edge, uh, you want to go consciously into that, and just going through it, going with it, and experiencing, being very aware of your own experience, and then again using, of course, consultation. Um, but in the here and now, you want to stay present. If you feel that there are situations that are way too triggering for you, you definitely should be able to read your own body language, or your own somatic signs that it's time for you now to maybe withdraw and not to go into that area. But most of the time, I think that as you are becoming more skilled, you can really just go with the flow and riding these waves and going into that discomfort. In maintaining the therapeutic effects for the group members. So again, it's not for your own therapeutic benefit, but you're going with it because that's what's needed in the moment to be there for your group members. Seeing and holding both sides of the coin at the same time is the next point. And what I mean by that is that when you are communicating something to one group member, you always want to be mindful that there are other group members who might be hearing your words in a different way. So when you are saying some kind words to one person, you want to be keeping that in mind, that how that will affect other group members. And when in individual therapy, we are normalizing a certain behavior or action, we don't really need to worry about that there is somebody else now listening who might be in a vulnerable spot, in, let's say, in the totally opposite experience as our client is. But when you are in group, maybe you want to validate somebody's experience. Somebody is discussing, is talking about a triggering experience, something that's really painful, hurtful for them. And while you are validating it in the group room, you have to be aware that at least there is always one person who will feel the other side of that coin. And very often this is quite a ball. It's not actually just a coin. So there are many different sides which you have to hold in your mind, even if you feel that now the right action is to validate this person's reality or experience. Expecting the unexpected is another important point, but I mentioned that with the spontaneity earlier. And being honest with yourself, um, it's a little bit different than being authentic and honest with your group members, but you really want to be also honest with yourself. And if there are signs for you that there is either a too strong countertransference situation or something like that, then you should be expecting that situations like that will arise, and you should have a set up consultation, a person who you can regularly consult with, and whenever you need it, you just want to go for it. I think it happens more often in group therapy. It's more likely that you will need consultation more often than in individual therapy. I also wanted to mention your role as a group member, as opposed to being the group leader. I think it's very important to experience both. I do encourage all of you to participate in groups, especially when you start leading groups. Uh, and in the beginning, probably the balance will be that you will be more of a participant in groups rather than the leader. But I also think, and my experience with serious group therapists, that they really seek out a lot of ways to be group members. There are lots of resources, events throughout the US and the world where you can join short-term intensive process groups, and maybe at conferences or at local conferences or on the national level. But you also want to consider joining a weekly group therapy environment. Experiencing both, I think, can be very, very helpful if you want to lead groups. And there is a big difference in being a group member or being the group leader, obviously. And um, what I mean by being in charge and responsible for others, that is when you are the group leader, you have a responsibility for your group members, and while you are being honest and authentic, you are not working on your own issues. So while you are interacting with your group members as a leader, you will be more watching for the whole group or for all your group members. You are responsible for all of them. But when you are a group member, then you really want to dig deep, and you really want to bring up what's happening for you in the here and now, and how you are reacting to people, because you are not responsible for your peers in a way as when you are a group leader. So besides having consultation for specific issues, when you are a leader, if you are having a countertransference issue with certain group members, when you are a group member and you are having issues with a very similar person, then your task is to name your experience, how you relate to that person, and how their actions and responses to you affect you. So you are really practicing skills when you are a member, even though it's a different setup, and you will not use that kind of communication when you are a leader, but you are really working your own understanding of your own reactions to specific group members. And because group is a microcosm And we do repeat our relationships and our actions and behaviors in from real life into groups where we participate. You can definitely expect that very similar situations will come up in groups where you are a member, as in groups where you are the leader, and you're kind of practicing and learning more about yourself, because you are really trying to verbalize and understand your experience when you are a member, which you cannot always do as a leader. And yes, as a member, you will just say what's on your mind. And self-disclosure is, of course, very different when you are a group member or a group leader. Um, and there is quite a bit of information that you can gain for yourself about yourself when you are a group member, and you will then figure out how to tweak it to when you are a group leader, when when you are not disclosing as much as a leader. I also want to say a few words about therapists in training. This is quite a specific setup when you are in a cohort model and you are participating in process groups. There are many training sites that work this way because most therapist sites, training sites, are the leaders, the clinical directors are aware of the importance and the benefits of process groups. So this is a great way of getting exposure to process groups, but you are at the training site where you are peers and colleagues, and you have other relationships. So in this situation, it is given that you have a certain dual relationship. When you are at a training site, though, the benefit of being in the group, that you are with like-minded people. Everybody is interested in the process, what's happening in the process group, and everybody understands the importance of being non-judgmental, and everybody understands the importance of the holding environment, and that it is a challenging type of work, yet practicing together to be honest and open and authentic. And if you join a therapy group or a process group in the community where not everybody is a therapist or a therapist in training, you cannot really expect the same kind of interest in learning and interest in growing in self-awareness. It is possible to find those groups, and there are groups where there are quite a few therapists or people who have gone through other practices of self-growth, and you can find those groups, but just in general, therapy groups, of course, it will be different. Um, and you might benefit from joining therapy groups or group process groups for people who are not at the same interest level with you in growing their self-awareness. But I just want to say that to warn you that you really have to think about that when you are entering groups of that sort. When we are talking about groups for group therapists or for therapists, and when we are talking about training, I just want to mention the difference between boundary crossings and boundary violations. Boundary crossings are inevitable, and this comes with the territory that when you are with your peers, with your colleagues in process groups, and it comes usually this understanding is implicit, or it's kind of we expect that we are going to have different relationships. It will be if you go for different trainings, you might see the same people. Sometimes the same people will be your peers. Sometimes you will be on some kind of administrative position, or in a board, or in something like that, with the same people with whom later you will be in a process group. So you really want to be aware of those boundaries and how much you're going to then be able to process in those groups. Yet it seems to me that most of the time it works pretty well. But boundary violations are a different, very different. Um, that's a very different process, or that's a very different situation. Boundary crossings are not excuses for boundary violations. Boundary violations are unethical, and most often are also it is a legal issue. But even without the legal side to it, boundary violations are unethical, and it's unacceptable. So you want to make sure that you understand the difference between those two. And this again comes with the territory of group therapy, because group therapy by itself is less protected than individual work. You, the therapist, you have your ethical and legal standards, and you still abide by the same rules as when you are seeing individuals or couples in terms of confidentiality. Um, but your group members, even though they signed a group contract, and you also talk about confidentiality, the importance of not discussing the material, uh, the group material outside of group, or if you are working with colleagues, you really want to remember what is it that you heard just casually, and that's not confidential information, whatever you heard casually outside of group. But you want to really remember, you want to make sure that you know what you discussed in the process group setting, um, and just to keep those separate. And it's again similar with socializing. The dilemma of socializing or not in groups where you are with peers or you are with colleagues. And this is really a personal. You will have your personal take on that. And at groups, when you are in a group at training site, it is inevitable that you are going to socialize and work together outside of the group. Um, the important, I think that the important gauging point is: do you feel safe enough among your colleagues and among your friends? The Just want to think about that, how much you want to expose yourself. While usually you enter process groups because you want to understand more about yourself. So if you're holding yourself back, then you're not really gaining what you went there for. And so you want to ask if participating in those sorts of groups, does it serve its purpose, or how much you want to participate in the groups, how much you want to socialize. So I'm talking about this because I think it is an important aspect of group therapists' skills and qualities, how much they engage in group work as members. But then this is something that you want to think about. The territory that comes with participating in process groups. The different skills and qualities of individual and group therapists. Um, Again, what skills do you use when you are in these two different roles? I just wanted to put this slide in here so you just to make you think about it. And again, about many of those previous skills and qualities I mentioned, that when you use them more, there's more emphasis on using those certain skills and qualities in group work rather than in individual work. Um, and the parallel process with clients: is it the right time? Where is my learning edge? What fits my personality and leadership style better? Meaning, I mean the parallel process with your group clients. What they are learning in group is in their interpersonal relationships is it the right time to learn those certain skills? Or maybe I jumped into this group as a group member, as a client, but maybe this is not the right time for me to focus on this. And where is my learning edge? Is it in the interpersonal realm, or is it more on intrapersonal issues that I would rather work on in individual therapy, in a dyadic work with a therapist? So the clients are asking themselves, or you might be asking your clients those questions about their engaging in group therapy as opposed to individual therapy. But you want to ask the same questions yourself. Do I rather want to work with individuals? Is that where I want to explore more my skills as a therapist? Or maybe now it's time to do some group work and learn all these group aspects that we have been discussing throughout this whole course. And for you, your learning edge, is it more in individual work, or is it more in this group work? And you might focus on one of them for a while and then go back to the other. And what fits my personality and leadership style better? Is it more individual work or couples work? There are therapists who are wonderful as individual therapists because their personality matches that kind of work, that the depth of that work, and the nurturing, their ability to hold that space for that one individual client. And then there are some other therapists who, for whom their ability, their personality fits the group work really well, and they can hold and maintain a whole group of people. That is quite a wonderful quality, I think. But you want to ask yourself which one is more important for you. And as we are coming to the closing of this course and this last module, I would like to encourage you to think about this whole the 9 weeks of this class. How was it for you? And do you feel that we, as a course, we went through maybe some developmental stages somewhat similar to the developmental stages of group work, both in the reading the materials and your intrapersonal development or insights that maybe you gained in this class, and also your interactions with your peers in the course. Maybe you might notice some kind of tendencies or some flow in there, starting creating the safety, and then finding your differences bit among you, among the group members, or in this case these class members. And then if you have worked through those, and if you have found some intimacy, you have found interdependence throughout the course, so these could be some similarities with what a group goes through as they are working through their task of whatever the therapeutic goals for that group. And then this comes to termination. This comes to the end of our class time here together. I hope that you have gained some understanding of group work, and that some of you will decide that it's a worthwhile undertaking to facilitate groups. And this is actually coming back to what I mentioned earlier. I think that the capacity to holding a group, it's very often it comes through the gaze. And we haven't talked a lot about this throughout the course. We talked about other aspects of group work, but I just thought to leave you with this thought. When participating in process group with artful leaders, one can often palpably feel the holding gaze of the leaders. When meeting the gaze of a leader, As they scan the room while other members are sharing, the client feels as if a sibling in a large family, and that the parent sees everything, and they can rely on the safety net invisibly stretched out through the space, and they can trust it will catch them if they fall. So I wish you similarly pleasant group experiences, and I wish you all the best. Bye now.